Hi, I'm Sal with Medicaid Ohio, and today we're going to be talking about another interesting cannabis topic. But first, I want to say a few things. First, thank you so much for the positive feedback on our first new video. We really appreciate it, and it did pretty well for the channel not uploading for a couple years. And we've had some issues with spam comments, but I think we've got it sorted out, mostly anyways. But seriously, we're grateful for the new subscribers and likes, and please, if you like what you're seeing here, share it with your friends on Facebook, Twitter, Instagram, wherever. Get the word out. Hopefully we'll be doing this weekly at some point, but regardless, I'm really excited to be doing this. So yeah, now that we got all that out of the way, let's dive in, because this is a pretty interesting one. The title of this video is pretty self-explanatory, but today we're going to be talking about cannabis and how it could be used as a tool to help people with eating disorders. So let's start by going over some appetite disorders and their specifics, and then we'll talk about how cannabis could impact those. So appetite disorders are a group of behavioral conditions in which a person's normal and healthy eating habits are affected by distressing thoughts and emotions. And these conditions can range from what is mild to life-threatening. Together, all types of eating disorders impact around 5% of the population, meaning nearly 400 million people worldwide. And today we're looking at a few specific conditions: bulimia, anorexia, and cachexia, or wasting syndrome. First, let's talk about bulimia. Bulimia is a serious, even life-threatening disorder. It's described as heavily caloric binge eating when unhealthy and inconsistent fasting in between binges. People with bulimia will often misuse laxatives and induce vomiting. This is in order to mentally correct the unhealthy binge they just went on. This is what's called an intense binge and purge cycle, and this can be physically and emotionally draining for the person. There's a lot more to it, and there will be with all these conditions, but those are the basics. So how could cannabis help with this? Well, prevailing research shows that cannabis is a powerful appetite stimulant, which most people probably already know. And while it's easy to think that maybe this appetite stimulation may be unhealthy for a bulimic patient, research is showing maybe the opposite's the case. When medicated with cannabis, most people experience pleasure and relief from eating, and because of the mood-enhancing effects of the plant, they're less likely to purge after their nice meal. Medicating with cannabis could also ease some of the negative side effects of bulimia that have to do with your mental health, like obsessive thoughts, depression, and guilt. Next, we're going to be looking at anorexia. Anorexia has a lot to do with body image and body dysmorphia. Usually, anorexia patients have a negative self-image in the physical sense and suffer from anxiety and fear surrounding becoming overweight, oftentimes unwarranted. Many anorexic people will starve themselves or even overexercise, both of which can be detrimental to their health. And like we said already, some preliminary studies have shown that cannabis can help reduce the anxiety surrounding body weight while stimulating the appetite at the same time. So none of the people in these studies have shown an increased body mass index, which is normal. And this is great research regardless. A lot of researchers seem to think that small doses of cannabis combined with some cognitive therapy could really help overcome some of these conditions. Finally, we're going to touch on cachexia, or wasting syndrome. Wasting syndrome is usually associated with a chronic or terminal disease like cancer, AIDS, and a lot of other serious conditions. The symptoms are pretty miserable. Extreme weight loss, loss of muscle mass, fatigue, a lack of appetite, and general weakness are at the core of the symptoms. While there isn't any concrete evidence that cannabinoids can increase muscle or body mass in patients, it's pretty hard to ignore the proven appetite stimulation that we've been drilling in through this whole video, as well as the decreased inflammation cannabis use can result in. Again, cannabis can help aid the mental health of these often terminal patients, which is extremely valuable when dealing with the obsessive and depressive thoughts of patients with medical trauma. There are also some minor cannabinoids that can work to combat different types of eating disorders. For instance, THCV has been shown to be an appetite suppressant and a stimulant, meaning 5 to 10 milligrams of THCV may be beneficial for people dealing with binge eating or even just trying to regulate their diet a little better. There's still a lot of research to be done on this topic, but these are the generalizations we've made about it. So we've already touched on how THC impacts the appetite, which is pretty self-explanatory. But how would CBD impact the appetite? CBD is known for its anti-inflammatory, antibacterial, calming, and muscle relaxing properties, as well as a lot more. However, it can target appetite in a complete different way than its companion cannabinoid THC. While THC stimulates the appetite by triggering hunger, CBD has been shown to stimulate the appetite by reducing nausea and anxiety. This is a much better choice for patients who struggle with high THC doses but would still benefit from appetite stimulation. If this short video has taught you anything, it should be that cannabis is wonderful and that we should value the many ways in which it can impact our life, and which it does when we use it. And to conclude this video, appetite disorders are no joke, and generally people who deal with them really struggle with them. And as far as we could tell, using different cannabinoids could really dampen the symptoms of some of these conditions, and just make life a little easier for the patients who deal with them, or even help dilute them over time. This is something we should take into consideration. Thanks for watching, guys. Be sure to check out the rest of the channels. We're slowly rolling out new content. Please leave a like and subscribe if you did like this so we know you did, and share it with your friends. Heck, share it with somebody who you think could benefit from a cannabinoid. Thanks again for watching, everybody. And like I said, check out the rest of the channel. We're excited to be here. Have a good one, stay safe, and stay medicated.